the theme of ACTRIMS this year was MS going viral. And so we really focused on, there was a lot about viruses in MS. Clearly the virus in particular is Epstein Barr virus. As there was a work by Dr Ascherio that came out recently in Nature that showed that exposure to Epstein Barr virus seems to be a very important trigger for developing MS. It seems like it may be necessary, but it's not the only risk factor for MS, because 95% of us in the general population have been exposed to EBV in the United States, but almost everybody with MS has been exposed. And so there was a lot of talk about strategies, ways that we may be able to change the disease course. One of those may be with vaccinations. So Moderna has a clinical trial going on in young adults of trying to vaccinate. And then there was an interesting trial that's being done at the National Institutes of Health using GP glycoprotein 350 to help vaccinate patients. And so or vaccinate not necessarily MS patients, but people, young adults as well. So the goal would be to try to vaccinate. If you could totally prevent viral infection, then maybe we could one day cure MS if you could do it in young enough patients. Unfortunately, a lot of patients get exposed to Epstein. A lot of people get exposed to Epstein Barr virus in childhood, so you have to start at a young age. But even if we could lower the viral load, it might lead to better outcomes. And there's been some postulating, like if you knock out B cells, that's where the Epstein Barr virus is in the B cells. So knocking out B cells with B cell depleting antibodies may be playing a role there. So some exciting research. There was also some data presented on HIV that the incidence of MS is much lower in people with HIV, but a lot of these HIV patients are on a hot antiviral therapy. And so whether that antiviral therapy is doing something is up in the air. So a lot of fascinating research on viruses and MS.